a lot of companies, and we do this too, we'll get a flat rate for the anesthesia, and it might be $500. But again, the consumer, like, this is the world that I've lived in for a long time, so I know what to ask. Like, I'm skewed. You can't unlearn what you know, right? But you're exactly right. They can't produce it. They don't want to produce it because this is how the system has been, and it's what's broken with it, and it's disheartening.
Well, it is, and people need to know what to ask. There is no way that a fully qualified surgeon who's going to do an outpatient, I don't know, rotator cuff surgery doesn't know his average time in the OR, the average number of supplies that he uses, and of course the estimate should say on it, let's be fair and reasonable here, barring complications or unforeseen conditions once we make the initial incision. If the x-ray shows one thing, but you open someone up and it's a total different nightmare, all right, your estimate just went out the window. But for some of these textbook surgeries that are being done, 20, 30 patients a day, you can't tell me that they don't know exactly how long it takes and what things they have on hand in every OR because they use it every single time.
That's right. And I would tell as a baseline, and honestly, a lot of your listeners would probably end up going to these facilities. But again, if you go to Free Market Medical Association or just go to Oklahoma Surgery Center and look at their website, you're going to find a very comprehensive set price. And it's turnkey, and what I mean by that is it's physician, anesthesia, and facility all bundled into one transparent price. And there's no surprise billing, period. That's the way healthcare should be delivered. And again, it's really only happening in the Midwest. You have really Oklahoma City is the grandfather. They've been doing it, I think, the last 20 years, and they're the ringleader. And they actually, they are the promoter of Free Market Medical Association. That's their arm. But they know that this is beyond them, so they've opened up other markets. But it really goes, Oklahoma City down to Austin and kind of all through small parts of Texas. But at least it gives the consumer a baseline like, okay, I live in Minnesota, but I'm actually going to go to that website in Oklahoma City, and I'm going to get a basis for a knee scope. Like, what does that look like? And you might actually fly to Oklahoma City to have it done versus doing it at home, because they're really going to find what you're talking about, Rhonda. Like, you can't get the pricing.
Yeah.
It's so hard to get.
It is. The other thing that's hard to get for some strange reason is the itemized bill. What do you suggest for people that ask for an itemized bill and they're refused?
Well, it's really sad because it's their bill. I've honestly not run into a scenario where I've not received an itemized bill. Again, that might be just because we know exactly how to ask, and you got to be authoritative when you ask for it. It's your data. In a weird way, though, it kind of doesn't matter if you get an itemized bill. It matters what you're going to pay on the bill. What the general consumer doesn't understand, there's all these kind of bill edits that would apply to that bill that would never be reimbursed by an insurance carrier that a normal person's never going to know. That's way complicated. I would literally just focus on what's the value of what I just had done. That's very hard to do. You can get some baselines, but I would probably revert back to what does Medicare pay on this bill? Ask the provider that. If you go to most providers, you can find, I can't remember, like networks. What networks are they in? And it will say they take Medicare, work comp, all the insurance carriers that they're in network with. I would kind of put it on the provider if I was new to it and say, what does Medicare reimburse on this? Let's say you had no insurance. What does Medicare reimburse? Like, make them tell you how much that is. Doesn't mean they're going to do it, by the way, but that's where I would start.
Yep. Or if you're really, on a tight budget, You could really have some fun with them and say, what does Medicaid pay for this procedure?
Yeah, and then if you don't have insurance, like to be a better consumer, like literally shop it around, call. Like they want your business, and actually they like cash pays. They'll tell you they don't, but they really do. It's cash in hand. There's no billing. Like I said earlier, 40% of most practices are dedicated to billing and collecting. If you can eliminate that, you're a good customer for them.
Absolutely. Anytime you can eliminate waiting for your money, it's a good thing. I don't care what kind of business you're in, you know.
Very true. Very true.
Net
That's
30
the
is
easiest step.
only for your good customers. Cash is
Well,
good.
you look at that same scenario from a practice standpoint, and you're a Blue Cross Blue Shield patient. They see you today. They're typically not getting paid on that for 60 to 90 days. I mean,
And,
what a
and
rat
that's if
race that
they
is.
and that's if they dot all their I's and cross all their T's in exactly the right way.
That's exactly right. I mean, it's a whole
That's
racket
before,
behind the
yeah,
scenes.
that's before the behind the scenes game that the insurance carriers tend to have going on for what goes on. But what are your plans for expansion? Are you gonna expand this around or what?
I don't know if I can answer that question just yet. I clearly think that way. I said earlier I'm a deal junkie and I like to scale businesses. And this is effective, positive change. And this isn't rocket science. I mean, this is a real value. This is a real value for groups, group health insurance buys to carve that expense out, inject direct primary care. There's other things that we can do. Like I'm a part of it's the exact same concept as direct primary care, but it's for dental. It's a membership. It includes 2 cleanings a year, 2 cavities a year, and you pay a set fee. There's no dental insurance premium. There's no copay. It's very clear. You get 2 cleanings a year, 2 cavities. If anything falls outside of that, they're going to bill you. That's between you and the doc, but it's very simple, and it actually promotes people to really go to the dentist, instead of, if you look at most of the dental cases I've looked at, the group has paid $10,000 in expense, and the users that actually use the plan, they actually spent $2,000. So you gave all that money to the insurance company and you didn't utilize it. That happens all the time, and they love that. You're a good customer for them because look how much they made on top of premium and commission and all that stuff. It's just I hate it. It's just such a messed up system. And again, anything that I can do to disrupt it and make it better for consumers, more transparent, like that's just what I'm passionate about.
Well, I think a lot of people would much rather just you know, send money in every month and know that the care is going to be there when they need it. And then, you know, you can always get a standalone insurance policy for catastrophic stuff. And, if the dentist says, gee, next year you're going to need this bridge or this crown, okay, well, give me an estimate, give me some time to save up for it, and I'll be back when I have to have it done,
Yeah. Not only that, but then shop that around.
Yeah.
All other practices, and this is, get your codes. Hey, okay, I'm at the dentist. I'm going to have 2 crowns. What are the codes you're going to use for that? Write that down, and then start to call other practices and ask for the same thing. And then you'll know the value. Like, okay, this guy's really giving me a good price, or wow, this guy over here really wants my business. Let me Google his name to make sure he's not killing patients, right? Like
Well, so
it's
many
not just
people,
about
yeah, so
it's not
many
it's not
people
about
don't
cheap care.
do
Like
that.
it's about
No,
value. Yeah,
it's about watching out for yourself and your money. People are willing to do that for their car, you know.
that's right.
Well, I just did it last fall for my car. My car needed a bunch of repairs, and there was one part that I thought they were really making all their money on. And I did a little research and I went back to them and I said, the average cost of this part is this, but you estimated that. You're going to have to come a little closer if I'm going to leave my car here and let you fix it. And they went, oh, well, and so I got a really big discount on my car. Now, most people are willing to do that for their car, why don't you do that for yourself? And that's what people just need to start asking more questions. Now, in the couple minutes or so, we got about a minute and a half left. Tell us how people can get in touch with you if they want to learn more about it, or, they want to um, get on board and, be a positive disruption in healthcare in their own way too. What can they do to reach out to you?
Yeah, I would say the easiest way for me would be my email. My email is Deeter, Deet as in Tom, dot Prater, Prater at outlook.com. And anyone that I could help, like I love helping people. I love disrupting the industry. Anybody falls in those categories, would love to help.
Awesome. Because I know there are a lot of people that it sounds to me like it would be so much less expensive to buy a plane ticket and go somewhere and get care for, a price you're going to get rather than spending two or three times that amount of money to get care where you already live and just kind of take the path of least resistance, which is not good in all
You're
cases.
absolutely right. You said it earlier. People just typically take whatever a doctor tells them, and you go here and do this, and you do it. But I would say stop and think about it. And again, we're talking about these massive healthcare systems. Why do they refer you to that doctor? That doctor's office might have a different name, but it's owned by this huge conglomerate, which is never transparent to the consumer. That in itself to me is not fair. I think there should be some kind of transparency, like, hey, we're going to keep you in the system, although this doctor is a better specialist and could fit your needs better than someone in my own humongous hospital system. But I have to, like, my company is going to make me refer you up the ladder to someone in our group, not someone external that would actually be better care for you. I would say just stop and think about it and do some research on your own.
Or, ask point blank, are you referring them to me because they're owned by the same company? Or are you referring to me because they're the best in the business in this geographical area?
That's a great way to say it. And some are going to be really offended when you ask that, because not very many people will ask them that, but it's a very fair question.
It is a fair question. And if they insist on referring you to a physician that is within their business line without telling you that it is in their business line, that's a violation of the Stark Law. So they really ought to answer that question, whether they want to or not. They really ought to, for their own protection.
Yeah, Stark Law is a very funny thing.
It's so hard to prove. I don't know that anybody ever gets in trouble for it.
It's a joke in a lot of ways.
Yes, that's why we're both laughing. Deeter, it's been great. I look forward to talking to you again sometime when we're not recording this show, because I think we've got a lot that we could do together. So I hope that we will have that opportunity too. But again, people, if you need to get in touch with Deeter and you want to learn more about direct primary care, it's Deeter, Deeter, Prater, Prater, at outlook.com. And this has been truly fascinating, because it's so good to know that there are people that are working to make healthcare work a little bit better and a lot less expensively than it currently works in the scenario that we tend to take as this is what we have for right now. So until next time, everyone, you know what I'm going to say before I say it. Be grateful, and you will attract good things. And until you come and join me again, I'm Rhonda Cobb, the Money Coach. Thank you for being here and being our listener.